Good day, madam. My name is Kesavartini and I'm paired with Ingrid. And today we are going to present about client rights and counselor responsibilities. So first of all, we'll look into the informed consent. Clients have the right to be told about their therapy and to make their own decisions about it. Next, a valuable and clinical, legal and ethical resource. Next, it is important that the individual comprehend the details given, provides voluntary consent, and it is competent to consent to care. And lastly, this is a phase that continues in working relationship. So now let's look into the 12 content of informed consent. Firstly is the curing procedure, which includes assessment. Next is the therapist's background. Third is the expenses in treatment. Fourth is the duration of treatment and when it ends. Fifth is the collaboration with co-workers. Sixth is the therapy interruptions. Seventh is the client's freedom to read their documents. Eighth is the diagnostic labeling rights are a collection of rights that apply to the labeling of medical devices. Next is the confidentiality, essence, and intent. Moving on with the treatment's advantages and disadvantages. Then comes the standard treatment alternatives. And lastly is the session tape recording or videotaping.
Now moving on to record keeping. From a few perspectives, and from the first one, the clinical perspective, is maintaining a record which includes a background that a psychiatrist may refer to while assessing the recovery plan. Moreover, in an ethical perspective, records will help physicians provide high quality treatment to their patients, and from a legal perspective, a record might be required under state or federal statute. Many doctors feel that true and precise health reports will help them defend against malpractice lawsuits. And lastly, from risk management perspectives, the quality of care is to keep proper records. The content for inclusion in records includes identifying data, fees and billing information, documentation of informed consent, as well as waivers of confidentiality, presenting complaint and diagnosis, plan for services, as well as client reactions to professional interventions. Moreover, current risk factors pertaining to danger to self or others, plans for future interventions, as well as assessments or summary information, consultations with or referrals to other professionals, and lastly, relevant cultural and sociopolitical factors.
Okay, now let's look into the ethical issues in online counseling. So there are three potential legal issues which include, firstly, is the competence of practitioner in providing online counseling. Second is informing the client of limits and expectations of the relationship. And thirdly is developing a plan for how emergencies can be addressed. So there are three advantages and four disadvantages in ethical issues in online counseling. The first advantage is reaching clients who are reluctant to participate in face-to-face therapy, as well as those who have certain disabilities or chronic illnesses that render them immobile. Secondly is improving client access in rural areas. And thirdly is the potential for greater numbers of people to receive services. Moving on with the disadvantages, firstly, the danger of making an inaccurate diagnosis. Secondly is compromising confidentiality and privacy. Moving on with difficulty in being able to protect clients in crisis situation. And lastly is the absence of traditional client therapist relationship and challenges of working through transference and counter-transference.
So, amongst these are suggestions for online counseling, and one of them is to screen clients to see if they're a good fit for the programs that they're considering. and to learn more on how clients use and interact with social networking sites, and to inform them about the potentially uncomfortable circumstances that can arise during distance counseling as part of informed consent, and to learn more about the ethical standards that have been created to direct your personal scope of work, as well as when doing online therapy, is to be mindful of the compliance concerns and state licensure board administrative provisions that regulate the individual activities.
Now let's look into working with children and adolescents. So there are important issues to consider. Firstly is the freedom of minors in terms of informed consent. Then comes access to details regarding a minor's condition by parents. Thirdly is the consent versus minors essence. Then involving parents in minors therapy is a good idea. Next is the confidentiality restriction. Moving on with dealing with apprehension. And lastly is the play therapy, art and music therapy, and outdoor therapy as requires supervised professional experience.
Now, taking a look at unethical behaviors of colleagues, amongst them are ignoring evidence of peer bullying is in and an act of itself unethical. Many experts in the field of social services are hesitant to discuss those issues, and peer supervision offers an outlet for ethical dubious actions to be corrected by informal peer monitoring. Moreover, if informal measures are not enough, reporting a colleague to a professional board is one of the several options.
Okay, now let's look into the elements of malpractice. There are 4 conditions that must be present in order for a malpractice lawsuit to be successful. Firstly, there must have been a working partnership between the psychiatrist and also the client. Next, the psychiatrist may have behaved negligently or improperly or deviated from the standard of treatment by refusing to include treatments that are standard practice in the society. And lastly, there may be a legally established causal association between the practitioner's incompetence or neglect of duty and the loss of injuries incurred by the claimant.
So, among these are the reasons of malpractice suits. Uneducated consent was not obtained or recorded, refusal to advise clients owing to disparities of importance, abandonment or early termination of a client, distinction from traditional treatment methods, and for a client, that's sexual assault, practicing outside of one's area of expertise, misdiagnosis or a faulty judgment, repressed or erroneous memories, transference partnerships that are really unhealthy, as well as failure to properly evaluate and treat a potentially risky customer. And these are the risk management. The process of concentrating on the detection, assessment, and management of issues that may cause clients harm and contribute to the filing of an ethical lawsuit or a malpractice suit. And personal and intellectual integrity and transparency towards customers are two of the strongest safeguards against malpractice, and in tough situations, to be aware of the shortcomings and to take advice, and to keep an eye out of any misunderstandings that, if not added properly, may result in a counseling split or premature cessation of treatment.
Okay, now let's look into the present day ethical issues. There are 2 of the present day ethical issues here, which is firstly is the confidentiality, and secondly is the HIV AIDS and the end of life choices. So in counseling, there are 2 types of confidentiality are commonly recognized: content confidentiality and contact confidentiality. Contact confidentiality requires that the substance or content of the client's discussion with a counselor may not be revealed by the professional. Disclosures of sorry, confen- confidential client information to individuals with no right to that information are called content breaches. Such breaches of confidentiality may result in civil liability to the therapist or licensure revocation. Contact confidentiality requires that the professional not reveal the fact that the client is being seen by the professional. Disclosures to an unauthorized party that the client is seeking the therapies are referred to as contact breaches. Although therapists often make strenuous effort to avoid disclosures of the identities of the clients, the law generally does not address matters of contact confidentiality. So the current controversies is an ethical concerns in counseling must be responsive to community parameters, cultural trends, and societal needs. For instance, rural settings or specialized practices might be necessary a different kind of multiple role management than larger urban settings. The challenges presented by HIV or AIDS and end-of-life choices have stimulated specific evolutionary changes in ethical guidelines for counselors. Under certain circumstances, counselors can choose to warn unaware sexual partners of clients with HIV or AIDS. They can also choose to maintain confidentiality if a terminally ill client wishes to talk about their possibilities of enacting an assisted suicide. As the healthcare costs continue to spiral out of control, stringent and limiting policies within managed care and state-funded policies present numerous challenges to ethical counseling treatment. Often, the money allocated for treatment is not sufficient to cover the cost of effective counseling. Further, counselors cannot abandon their clients without providing at least some possible alternative for care. These current concerns illustrate the necessity for ethics codes to evolve in response to change in the needs and demands of the culture in which the counselor practices in the client resides.
Moving on, we will now take a look at ethical codes as well as the issues in cultural diversity within the present day. So, in the ethical dilemmas in context, a dilemma is generally defined as a circumstances or situation that is perplexing because a decision is required between equally unacceptable or unfavorable choices. An ethical dilemma incorporates the concepts in preceding definition and is a situation in which there is an apparent conflict of moral standards or imperatives. In essence, to uphold one standard would mean violating another. For example, many of the ethical codes in counseling and psychology are based on what some define as universal moral principles. The most commonly identified moral principles are autonomy, non maleficence, beneficence, justice, fidelity, and veracity. Those who uphold these principles will support clients' freedom to be self determining in word and deed, autonomy, will do no harm to clients, non maleficence, will do good or promote clients' health and wellness, beneficence, will be fair and equitable in their treatment of all clients, justice, will be trustworthy and uphold their word and promises, which is fidelity, and will be truthful in their interactions with clients. So, these moral principles are typically presented to counselors as a holistic set of discrete and equally occurring ideals. Yet, in reality, these principles are in relative contextual tension to one another. Upholding one principle will have some impact, positive or negative, on the others. Counselors may encounter an ethical dilemma when they consider the circumstances of involuntary hospitalization of an imminently suicidal client. Now, the client's freedoms, which is their autonomy, will be restricted or impeded in order to promote good for the client, which is their beneficence, to keep harm from happening to him or her, which is non-maleficence. Now, as we identify ethical dilemmas in cultural diversity, it is an act that might appear to be ethical violation to a white male counselor may not be considered unethical when viewed by first-generation Hispanic American female. For example, we'll look at this case in scenario where both counselors are providing counseling to male teenagers from Korea. In the course of counseling sessions, each counselor asks his or her client to have the family attend the next session in order to begin family counseling. At the next week's session, both clients bring their family members to the session, and each family is composed of some combination of at least one biological parent, one biological grandparent, a couple of siblings, and two cousins, and another person who is generally described as a neighbor or friend. However, one counselor allows all the family members into the session, while the other counselor does not, because the cousins and neighbors or friend are not really family members. So here clearly these two counselors have very different ideas as to what constitutes family and who should have access to client information. Both could be practicing ethically according to their interpretation of the ethical codes, and depending on one's point of view, both may be endangering an ethical dilemma as a result of their actions. The questions are these: which actions by the counselors promote clients' welfare, and what actions may the counselors need to take to ensure all parties are fully informed of the consequences of their decisions? Hence, dilemmas are difficult and complex events to resolve because there's no easy, clear, or definitive answers, which then results in vagueness of resolvement, which is an ethical issue in itself.
Of ethics, we have the following declaration, B3, which is duty to warn. When counselors become aware of their client's intent or potential to place others in clear or imminent danger, they use reasonable care to give threatened persons such warnings as are essential to avoid foreseeable dangers. Very briefly, the Tarasov case involved Dr. Thomas More, a psychologist working at the Counseling Center of the University of California at Berkeley. One of his clients at the center was a 26-year-old graduate student who during his counseling session disclosed his wish to kill Taliana Tarasov, his girlfriend. Dr. Moore took his client's disclosure seriously and reported his concerns to the campus police and expressed his intention to proceed with commission of his client for a psychiatric evaluation. Excuse me. The campus police interviewed the student but released him from custody when he promised to stay away from Miss Tarasov. Neither the police nor Dr. Moore warned Taliana of the threat, and the student did not return to see his counselor. Just 2 months later, he fatally stabbed her on the steps of her parents' home. Her parents initiated a lawsuit against Dr. Moore, the police, and the Board of Regents of the university. Although the Tarasov claim was dismissed twice in the lower court, when it went to the Supreme Court of California, it concluded that Dr. Moore had a duty to warn Ms. Tarasov of all parents of the threat. The court stated that confidentiality must yield to the duty to prevent danger to others when the danger is foreseeable. This frequently referenced case gave rise to the now well-known maxim expressed by the judge at all times: the protective privilege ends when the public peril begins. Moving on to case 4, a young person's consent to common law, which is minor age limit. Also, because of the concept of competency to consent has emerged since time as taking precedence over any arbitrary age limit such as the concept of minor. In this case, a pregnant 16-year-old girl had left home to seek access to an abortion. Her parents were opposed to her obtaining an abortion on moral grounds, and they went to the court to prevent it, arguing that she was not competent to give such consent. Although the court expressed empathy for the parents in these circumstances, it concluded that the girl understood the abortion procedures and the associated risk. She was therefore judged competent to give her informed consent, and her parents' objections were overruled. Interestingly, the court ruled that a parent's right to make treatment decisions for their child terminates if and when the child achieves a sufficient understanding and intelligence to fully comprehend the treatment proposed or recommended.
Now, moving on to the negative consequences of policy, we'll take a look at the case where a psychiatrist learns from a woman who was referred for sexual aversion that this problem, as well as fibromyalgia, migraine headaches, and chronic fatigue syndrome, developed immediately after discovery of her husband's affair last year. 8 years previously, she had developed the same problems after her first discovery of his betrayal. Her symptoms then lingered on for 3 years. Here, the court ruled that considering that each of her four separate persistent disorders is officially of an unknown etiology, the clinician might consider writing a detailed case report. And because her sexual aversion disappeared after 8 sessions of therapy, describing the essence of the therapist patient dialogue might add to the compelling value of the manuscript. And if the psychiatrist has to ask the patient for permission, here it would lie an ethical dilemma, which would then harm the patient as her confidentiality is released. And that is all for our presentation. Thank you very much and have a good day.